Hi, my name is Dr. Sherine Reno. I'm a sports medicine MD. I'm board certified in physical medicine and rehabilitation, and my practice is here in the Dallas area. I did my medical training at Baylor College of Medicine in Houston, Texas. Did residency there as well. I didn't do medicine first. I actually came by medicine second. I originally majored in dance with a theatrical emphasis. I had a wonderful life before medicine. I actually was a member of two different ballet companies, two different modern dance companies. I was in a couple of different musical theater companies, one of which was a touring company that did Shenandoah in 1976. As I was teaching and being dance captain in all these companies, I had to help injured athletes and injured dancers get back to performing as quickly as possible. I would always go back and say, okay, what is the physics? Why can't they do this? And I would have to say what muscles I would have to stretch and what I would have to strengthen to allow them to do the technique correctly. So I've always been, not only an artist, but an analyst. But I just kept that call back to the sports and the athletes and the biomechanics, and there was just nothing I could do other than do it myself. My greatest joy is figuring out what the problem is, creating a plan of how to correct it, and then seeing them back out there performing and competing at their best. I have the great fortune of being able to treat many elite level gymnasts, dancers, skaters, and so I actually can see some of them on the TV from time to time. And it is just a joy when I know that I've helped them along their way. I do get patients that have seen 4 or 5 other doctors, and they don't do the biomechanical analysis. And when we do that and we find out where their injury started from, that's when we can get them better. And so it's a joy when they're going, I'm finally back. I bike and I still dance around my house, and do a little swimming. My practice is a sports medicine practice. Its name is Performance Sports Medicine. We primarily treat any kind of musculoskeletal injury. About half of my practice is 20 and below, and half is above that. And we treat all ages. We have our youngest patients as young as 10, and our oldest patients, we have still people who are very avid golfers at 70. We treat the spine, we treat shoulders, we treat elbows, we treat wrists, hands, knees, hips, ankles, and feet. So anything that you can injure in a sport, that's what we treat. About 90% of sports injuries do not require surgery, and so that's what we concentrate on. When they do, we have the best surgeons in Dallas that we refer to, and often some that treat some of the elite level athletes as well. As long as they're on your insurance network, we'll try to get you there if you need that. If you need treatment for swelling or ligament injury, or if you have arthritic kind of condition occurring, we treat all of the things that go to treating any injury that you have. We do the pre-op or prehab therapy, and we do post-operative therapy as well. I'd say a great majority of our patients are athletes. They come in usually with an acute injury. It is not uncommon that once we've finished treating them and they have a good outcome, that we do get family members and friends and things like that that have painful or non healing injuries, and they come in for treatment too. So like I say, we do have a wide range of conditions that we treat. The only thing we don't do is chronic pain, or if somebody has an autoimmune like a rheumatology kind of thing. Well, we are a little bit different setting for medical in that everybody that you will work with, even as far as the front desk people, have been active in a sport or artistic profession such as dance or skating. We'll learn a little bit about your life and your lifestyle and sharing your joys and your sorrows, and it's just people feel like they're family there.